All right, welcome to episode 8. Good friends, good medicine. East meets West. My name is Tom Rolley, doctor in Mullumbimby, New South Wales, and I'm joined by my good friend TJ Frank. How you doing, TJ?
Aloha, Tom. Good to see you. I'm joining you from Maui, Hawaii, where I practice as a Chinese medicine practitioner and acupuncturist.
Nice. How's business? You busy?
Oh, man, it's a conveyor belt. It's grateful. I'm very, very grateful, very blessed, and very honored to be able to serve so many people in the way that I do. It's wonderful to work in complementary and alternative medicine to help people that want adjunctive therapy or alternative therapy for common problems. Complementary and alternative.
That's brilliant, dude. That's so cool. I've been busy as well. I'm going on holidays for a little bit, so it's backing up. All right, today's topic. Why don't we jump in? Migraines. So Western diagnosis. I'll jump in on a couple of. This is really a history diagnosis for me. Main features are going to be a unilateral headache. So for me, when patients come in and say, hey, I've really had a bad migraine, I want to confirm that is indeed the medical definition of migraine. So I ask them where it is, and the medical is half the head. Typically, it would have a pulsating quality, so throbbing or pulsating, and usually associated with like sensitivity to sound and light. And also, they can have nausea, sometimes vomiting. To make the diagnosis, typically there'd be multiple episodes of this similar kind of headache, and the duration typically would be 4 hours up to 3 days with these things. If it goes beyond 3 days, then it enters into a different diagnosis, status migrainosis, basically migraine that's persisted beyond 3 days. Associated with stress can trigger it. Also, there are, for some people, they'll have food triggers. So things like wine, cheese, chocolate, tomatoes may trigger the headaches as well. So patients may know about those particular things. And then getting down into the specifics for me, the two that you can either have it with an aura or without an aura. An aura would be a preceding kind of neurological events. So typically some kind of visual disturbance, like a flickering of the eyes, jagged lines, something along those lines. There may be other types of aura. Maybe they get a sense of smell. Perhaps, but typically be some kind of neurological experience for it. So if they get the aura, then that would be called classical migraine. So the headache, sound and light sensitivity, nausea plus or minus vomiting, and the aura is classical. And then common migraine is without having no aura. So look, theory-wise, from my perspective, look, the original idea was some kind of spasm of the vertebral arteries coming up the back of the neck and decreased blood flow to the back of the brain. So that was the explanation for the jagged lines or the aura, and then the internal carotid opening up to bring more blood flow to the back of the brain and giving its throbbing nature. Now, I was checking out on the latest stuff, and they reckon that that's not correct, but that it's rather some kind of neurological part of the brain that's somehow releasing in synchrony, or like almost like an epileptic kind of thing. But I know from a just a straight pathological point of view, it did seem to make more sense to me that the arteries constricting, and there may well be there's a link to oral contraceptive pill use, so increased estrogen, and quite a few women were seen to get it premenstrually, and whether there's increased sensitivity to those vessels contracting at that point. Normally, examination should have normal neurological examination, and investigations normally isn't that helpful. This is largely a history question, and working out from there. So lots of, but the main features: severe unilateral headache, nausea and vomiting, pulsating quality, sound and light sensitivity, and then plus or minus the aura. So that's kind of like the rough rundown on migraine. It's not super detailed, but yeah, I'm interested to see what you've got, TJ, from a Chinese perspective.
Oh, thanks, Tom. It's cool. The symptom picture that you're describing from a Western perspective, it closely fits one of our differentiations. I love it when they match up. Once again, with any Chinese medicine condition or any medical condition, the Chinese medicine practitioner looks at it through the system of 8 principles. Is this something from the outside coming in or from the inside coming out? Is this something hot in nature or cold in nature? Is this an excess condition or a deficiency condition? And is it of a yin or a yang in characteristics, that's a Chinese concept and philosophy, yin and yang. It requires more explanation. But you see the basic aspects of 8 principles. They play out significantly in migraines. Overall, as I was telling you, there's 10 different differentiations in Chinese medicine for migraines. So what that means is 10 different clients could come in, and each of them could hold an entirely different etiology or pathway that led to their condition. So it's a pretty high level of breaking it down. The first main breakdown is this external or internal. We call them exogenous or endogenous. Within the
Oh, buddy, we're glitching. Hold on. Lost you.
specific. The exogenous, the outside ones, things from the outside. It's kind of weird. In Chinese medicine, we see the body as a particle cloud, not quite as fixed on the organ level. Like on a molecular sense, we're just a bunch of molecules in an area of density. And therefore, if we're surrounded by wind, as an example, the wind would affect the particles in the cloud. Or if there's damp or if there's heat, it would bog it down, or the particles would start moving faster. It's just we're in relationship to our environments, and the environment can affect our body. So the head's the top of the body. It gets readily exposed to cold, to wind, and to damp, and to heat. So all of those can contribute to the occurrence of a migraine. The exogenous migraines are typically acute. They come on quickly. They're severe. They last typically short in duration. They have the throbbing quality to them. What else? Oh, the thing that really makes the exogenous differentiatable is that it's worse in exposure to outside stuff. If they go outside in the wind, the cold, or the heat, it makes it worse. So that's a clear diagnostic criterion for the differentiation of an exogenous migraine. And the endogenous ones from the inside, there's a whole bunch of them. There's a whole set of inside excesses that can cause a migraine. The three main ones are liver yang rising, liver fire, phlegm turbidity, and actually there's a fourth, my mistake, it's 4, not 3, blood stagnation. So those are the internal excesses. The liver yang rising and the liver fire are very similar in etiology. They're both presented as liver fire coming up. So the person's going to have a wobbly head, distended temple veins, red eyes, irritability, anger. The head's going to be coming up, and that's where it gets that swath over the temple that you're describing unilaterally. And it's a throbbing because it's a heat coming up, and it goes to the eyes. So the whole aura idea, visual disturbances, because the heat goes through the meridian right to the eye. You even showed that with your hand when you made the pattern. It goes to the eye. You're aware of it subconsciously. In any case, liver yang rising is because there's a yin deficiency. So they're very similar, but there's going to be night sweats, sweaty hands and feet, and possibly ear ringing with the liver yang rising excess. The other liver fire, they're going to have the same symptoms, but the yang rising will have the underlying yin shu. The liver fire will also have irritability, but it's going to be worse. They're going to be angry. And they're going to have a shouty voice, but they're going to be shouty. I mean, this is liver fire. red eyes, and then the liver fire is going to have a red tongue with red swaths on either side of the tongue on the outside. The liver yang rising won't have that. It'll have a thin red tongue. So they're differentiatable in several different ways. That's the etiology you were describing.
Yeah, cool.
The other internal excess is the phlegm turbidity, which is interesting. The phlegm turbidity, the fluid of the brain getting mucky and not flowing well. Phlegm turbidity affecting the brain. These people are going to have a heaviness sensation in their body. It's going to be worse with damp. They're going to tend to live in damp environments. They're going to have a really thick, greasy tongue. They'll typically have like a borborygmus and bubbly guts. Even all the way to morning diarrhea, just the daybreak diarrhea we talked about with the digestive weakness and the accruement of phlegm in the body. And then the last internal excess causing migraines is blunt trauma. Somebody gets whacked upside the head, they're going to have headaches on that side of the head. So we include blunt trauma. We call it blood stagnation. The blood getting fixed and sucked. This one is characterized by a fixed focal point of pain that's fixed throbbing. Sharp stabbing pain. We'll have a purple tongue, a choppy pulse. So those are the etiologies that I've covered so far, are the outside, the exogenous excesses, the endogenous excesses, and then the last category is the endogenous deficiencies. This is another interesting category. It could be qi deficiency, blood deficiency, and what's the third? Oh, kidney deficiency. So the one that I see most often is the blood deficiency. And these people will have really pale tongues, and this one's really, really common in women that it's because around menstruation, if they're already low on blood, when the blood descends, there's not enough blood going up to the brain. And they get migraines typically behind the eyeball part of it. And it's a dull, distending, hollow sensation. So that's a blood deficiency differentiation. Let's see. They'll also, in extreme cases of blood deficiency, will have palpitations, and then insomnia, decreased memory. That's really about it. That's extreme blood deficiency. Now, this is blood deficiency that's not necessarily testable by doing a CBC or a blood count. This is blood deficiency from a Chinese medicine perspective, which is subtherapeutic from Western clinical diagnostics. The other two internal deficiencies are the qi deficiencies, consistent dull headaches, worse with exertion and better with rest. And then the last etiology is kidney deficiency. So empty feeling in the head, hollow, distending feeling in the head, that also has the comorbidities of lumbago and knee pain, low back pain, knee pain. Listlessness, urinary incontinence, general fatigue. So that's what we got. In summary, we got 10. When cold, when damp, when heat. We got liver yang rising, liver fire, phlegm, damp accumulation, blood stagnation, qi deficiency, blood deficiency, and kidney deficiency.
Wow.
That's the breakdown.
Interesting. So what? Just to check. So around the women when they're menstruating, the blood descending. So just to clarify, I mean, the Chinese medical concept of blood is different from the Western concept of blood. Is that correct?
It's both. No, it's both. We share a common perspective of blood, that the spleen recycles the blood, that the heart pumps the blood, that the marrow generates the blood, that there is blood in the body. I mean, we see the physical aspect of blood, but we have different aspects of it as well, in that the spleen processes the blood. The liver is the storehouse of blood in Chinese medicine. The liver and the descending aorta are what the Chinese call the seas of blood. So the two most vast regions of blood in the body, the two areas of the body that hold the most blood, are the liver and the aorta. And that makes sense. You know, the liver is a big organ. It's got a lot of blood in it.
Yep.
It's a filter. So we have similar and different.
Okay, cool. And then but at the time of menstruation, the blood descends so it can come out, but there's not enough to get to the brain. And that's why
this is another difference. The specific pathophysiology, or just physiology from a Chinese medicine perspective, being that the liver is the storehouse of blood, when menstruation occurs, the blood comes from the liver to fuel the menstruation. The liver also dominates the eyes in Chinese medicine. This can be seen in hepatitis with yellow eyes, and alcoholics with red eyes. And the eyes are a reflection of the liver. There's a connection in Chinese medicine there. So as the blood descends through menstruation through the bi-mao, or the internal branch from the liver to the uterus, the blood draws down in the system, and the eyes get the distended, hollow migraine feeling.
I bring it up because I have seen patients with that, like just right over the women.
That's
it's
it,
not
man.
a full kind of thing.
It's just right there.
Behind the eye.
Yeah, Juha, Tao Hong, Siwutong. There you go.
Is that a formula?
It's an herbal formula. They would feel fabulous. We'll get into therapeutics next.
Yeah. All right. Well, let's go there. They did skip out just for a little bit on the internet on the first three: the wind damp, wind cold, and wind heat. So they were all exogenous coming in. Can you just run through?
So let's talk about those again. So the outside things that cause migraine, wind, cold, heat, and damp, they're characterized primarily by worsening and exposure to those elements. Mm-hmm. If somebody goes out in the wind cold and the migraine comes on, or the wind damp, or when it gets really damp and humid and it comes on, or if it's really hot and it comes on. The wind cold has typically a pulling type of pain. It's typically more posterior in the section of the migraine area. They may also have a stuffy nose and body aches for the wind cold. Cold gives people runny noses, and their tongue will be white, and their pulse will be floating and tight. The wind heat people will have more of a distending, and they said a splintering sensation pain, like a splintering. And it's worse with heat. They have a red face, a red tongue. They're typically pretty irritable. Mm-hmm. And then the wind damp ones, they say it has a sensation of traveling around the head like a wrapping or a towel.
Oh, okay. Cool. Yeah.
So they say that, and that one, it's usually comorbidities of a heavy body sensation, decreased appetite, and they'll have a thick, greasy tongue and a floating, slippery pulse. Whereas the internal excess damp phlegm accumulation, they'll have a slippery pulse, but it won't be floating. It'll be a deep, slippery pulse for the internal excess, just as far as the differentiational criterion.
Cool.
I'm hoping part of the community that benefits from these podcasts are practitioners already certified, be that acupuncturists or Western MDs already doing acupuncture that want additional training and more specific treatment guidelines for conditions they're seeing routinely.
That's that. Yeah. No, my hope as well that we can help out those guys. The dampness sounds like what I would call tension type headache. The all over the head. So it's interesting, super interesting. I like the differentiation though, and the confirmation, because tongue diagnosis is not really strongly part of Western medicine, and yet it seems like there's a lot of signs.
It's essential.
Yeah,
there's quite a bit. It's very reproducible anywhere in the globe. And, to do Western science with Chinese medicine is very difficult because we can't do a double-blind placebo. It's essential that the physician gets to see the specific client and specifically curtail an herbal formula. We can't just say migraines, you give them a sugar tablet and you give them Tao Hong Siwutong and we see if it works. Like, that's just not how it works. We got 10 different formulas. Even when we get the formula, we've got to amend it for the specific person's condition. That can't be done in a double-blind format. No. And then even the double-blind format for needle insertion. How do you do sham acupuncture? They've tried so many different ways to introduce a placebo. And that's only assuming needle's effect is mechanical. What if there is a vibratory component, the person's thought being as a practitioner, and their ability to manipulate energy through their intention using the needle as an antenna device? You can't do that in a double-blind placebo format. So this particular system of medicine has been developed over thousands of years empirically, over millions of people and recording what the effects were without doing the double-blind placebo, null versus alternative hypothesis, scientific reductionistic method.
One of the interesting things to me on the double blind is like the intention of the person doing the test in the first place, like from quantum mechanics, where the observer is influencing the results. You almost need to do two entirely separate double blinds, with one person holding that it's a success and one person holding that it's a failure, in order to, I mean, the numbers that you need to get that to thing, like the fact that quantum mechanics says this, the observer influences the results, so it's very challenging.
It's another subject in debate, the efficacy of scientific method. You and I met as science students in University Davis, UC Davis, and we're both scientists by root. And we both agree, I'm sure, that science has provided phenomenal things for society and advancement of all arenas of our daily life. That being said, there are limitations to all methods and models.
Absolutely, yeah.
Yeah, so getting back to Chinese medicine, it's a different way of going about the system. And, there can be a question asked, is the human body the cells that exist after death, or is the human body the vibration that occurs between the cells that exists during life that ceases after death? The mechanistic model of the human body is a machine made up of particular parts, or the vitalistic method or visualization of the body, that there's a vital force moving through the clay that keeps it alive. So the Chinese medicine is a vitalistic perspective of the human body, that there's a vital force or fluid moving through us that's in connection to our environment. And because it focuses on the vitalistic theory versus the mechanistic theory, it's mutually complementary. They complement each other. Oh. It's the future, I think, of the best medicine possible, is to bring them both together. Being
brought together,
yeah, because the mechanistic model is right, but the vibratory model as well, that there's a vital force moving through the body. There is something that happens before and after death, and the cells are still there. So regardless of that, let's get back to migraines. Migraines does see the body vibratorily, because if there's a heat in the body coming up, it can create it. If somebody's in the sun too long and they get hot, it can create it. If they get too emotionally bent out or pissed off, it can create it. If they got too much damp and phlegm in their body, it can create it. If they've got a head trauma history, that could create it. If they get exposed to the wind, cold, damp, or heat, it could create it. Or if they're just too weak and they don't have enough blood, that could create it.
Yeah.
That's a common layman description of what I just did through the differentiation model, Chinese terms.
Nice. That's pretty cool. Yeah. All right. Let's jump in for treatments and see what we got. All right. So what do we got here? Look, from my perspective, acute. So basically, it's split up into management of acute migraine and then into prophylaxis or preventative treatment for migraines. So acute, look, anything from anti-inflammatories, aspirin or Nurofen. Water seems to help. Hydration seems to help. We do have a specific class of drugs called triptans. So sumatriptan, also known as Migraine over here, and it seems to constrict the blood vessels. So it goes with that idea that the internal carotid pulsating, but that can help reduce the headache. Other ideas around management of the nausea, so Maxilon or Stemetil, medications that decrease nausea. Typically, like sleep really helps for these people. So getting some sleep, dark room to minimize the disturbance from the light and from the sound. But it's interesting how sleep really does seem to shift migraine for a lot of people. More other ideas. Sometimes in the emergency department, I've seen Ligactyl tried. So they run in Ligactyl. Codeine can sometimes help to decrease the headache. So kind of like a symptomatic management at some level, decrease the pain, increase fluid, get sleep, and hopefully it shifts. What else we got? Ergotamines, old usage was ergotamines and caffeine. I don't think we can get ergotamines in Australia anymore, but this was like a fungal kind of preparation that came off, and somehow it helps decrease migraine, but not. I forget why the reason is, but we can't get it here anymore. In terms of prophylaxis, excuse me, so avoiding triggers. So if it, chocolate or wine, cheese, caffeine, whatever it is, if they know the trigger, then avoiding that. It's quite varied, and it's interesting in terms of seeing all the differentiations from a Chinese perspective, whether different medications from a Western perspective are coming in and affecting different ones. And so that's why some of them are effective for some patients and some of them don't work and other ones work. And that's what I'm wondering as I go through. So things like beta blockers, propranolol, can be used. So typically this would be like if a patient had a concomitant, say, anxiety or hypertension, then propranolol could decrease their propensity to get migraines. Other things would include pazotafen, which is another type of drug, and this seems to be helpful for the ones with auras. So pazotafen would be helpful, propranolol, amitriptyline, which is an antidepressant originally, but seems to work across a whole bunch of stuff. So that's the brand name over here, Endep. And we use that also in neuropathic pain. So it's interesting that may help. And then also some epilepsy drugs, sodium valproate and topiramate. So it's interesting to me that those medications, like there's this whole class of medications that seems to have multiple effects across, like, say, migraine, chronic neuropathic pain, depression, that our understanding of how these are working in the brain is not great, and yet they do seem to help some people. But that's the basic rundown for preventatives. So propranolol, pazotafen, the anti-epileptics, and amitriptyline. And basically kind of be just working through, okay, how did that go? Giving it some time, did it work? And see how the results are. And they typically would have to track their headache frequency. If it was once a week and now it's once every 3 months, then that would be counted as a win. If it made no difference, then obviously we stop that and try something else. So yeah, acute and preventative medication from a Western perspective. Yeah, what do you got?
I really liked what you hit upon. If somebody, maybe even you, could be a pioneer using TCM differentiation with each of the migraine cases, just write down on the side of the chart what the differentiation was and what medicine you prescribed. And somebody could collect a record base of, if it's a wind cold, this one, if it's a wind heat, this one. And to be a little bit more specific in the methodology rather than trying one than the other. Just know, this is a liver fire type. The amitriptylines free the liver chi. This is going to work it's a liver type. This is the one. I think that'd be a beautiful bridge gap that could benefit a lot of people, because they could then access the right Western medication much quicker rather than having to go through so many sequentially.
Absolutely. I feel like these medications are having an effect from the Chinese perspective. Like it may not, it's not quite the integrated, doing all the things that the Chinese herbs do, but I feel like they do have an effect. So, of course,
they're the same body. Remember, I told you once, my teacher, Roger Batchelor, Dr. Roger Batchelor from the National College of Naturopathic Medicine, who's a Chinese doctor. And he said, if you ever want to understand what organ a Western drug affects, look through their side effects. If you want to know which organ a Western medicine affects, look to its side effects, and it'll tell you immediately, that enters the lung, that enters the liver, that enters the kidney. Because that's how we would say it. It's an herb that enters the kidney.
Yeah, right.
Well, in any case, so yeah, that's a good thing. So from a Chinese medicine therapeutic perspective, the broader envelope or discussion is Chinese medicine has 4 branches of methodology in therapeutics. So instead of just using pills or physical therapy, we have 5. The 5 branches: herbs.
Yeah.
Did I say 4?
You said 4.
Oh, my mistake. 5 branches. My mistake. Thank you. The 5 branches being herbal therapy, diet therapy, movement therapy, being Qigong and Tai Chi, massage therapy, and acupuncture. Even within those, for example, in acupuncture, that includes moxibustion, cupping, and even bloodletting. So there's more tools within each of those. So those are our 5 therapeutic branches. So different etiologies or different differentiations may use different ones. With the exogenous, the wind cold, wind damp, and wind heat, this is a rare case. There's one herbal formula that can work on all 3, which is super cool. It was a really beautiful formula. Xuanxiang Cha-Cha Tianwan, which I just like the name, the Cha-Cha. But Xuanxiang is a herb primarily for headaches. It's a blood mover. I don't know if vascular dilates or constricts. I can't say, but it affects the blood flow in the brain. And then it's got a bunch of herbs, like 5 herbs to clear wind. It's just so strong at clearing wind. It'll clear any of the wind, cold, damp, or heat. The Chinese say the wind's the worst of all the outside stuff because the body's wet, it'll blow the wetness in. If the body's cold, the wind will blow the cold in. If the body's heat, the wind will blow the heat in. So this formula works by just kicking butt on wind. It's got Fong Fong, Jing Jie, Bai Zhi, Bo He, Qiang Ho. It's got this, like, all these just great wind releasing herbs. So it's just a basic formula. It opens the pores and blows out the wind and releases the cold, damp, or heat. So there is an herbal formula, lucky, for that particular etiology, the exogenous. Once again, with herbs, a good herbalist would then modify the formula in specific. If the person has a little more blood stagnation, they'd add a few different herbs, Taoren, Honghua. So it's important to get a good herbalist to dial it in.
Yeah.
So the other things with the wind for treatment is to cover oneself, not expose oneself to the wind. And that's all I got on the exogenous, basically. There's not much you can do dietarily. Have a lot more green tea and mint tea and green onion tea and ginger after food. Those things are dietarily beneficial to this group, this population. And then for self-massage for the exogenous types under the head, and just a lot of brushing on the head to try to open up those areas to release. Let's see, the acupuncture, gallbladder 20, 16, bladder 12, lung 7, large intestine 4, bladder 10 for wind cold. The top of the head, a lot of local points around the head. Bladder 12 to release the lungs. Lung 7 to release the upper part of the body. LI4 to release wind. Bladder 10, right where longissimus attaches onto the head for the exogenous because the wind blows in there. Local points. With acupuncture, we do local, distal, empirical. So with the acupuncture, there's going to be a lot of local points. Mm-hmm. And for people that aren't acupuncturists or don't have access to acupuncture, they can do self-massage on these acupoints. The wind heat guys are going to do something a little bit different. LI4 and 11 once again, but GV14, the crossing point of all yang, right under T1, fabulous release point for migraines of the wind heat, or any of the liver fire and the liver yang. All 3 of those etiologies, GV14 is a fabulous manual release point or acupoint. And then when you get into the external wind damp, it's the same wind releasing points, GV20, LI4, 10, but there's the added point of spleen stomach to transform the dampness in the body, to boost the spleen stomachs, the CV12, bladder 20, the back shu, the spleen stomach, stomach 36. There's added digestive points to help transform the damp. For the treatment of the internal excess, for the 2 liver yang and liver fire, they're pretty similar in the treatment. There's going to be a lot of liver points, liver 3, liver 2, gallbladder 43, and then some anchoring points to bring the energy down, kidney 3, spleen 6. And then tai yang, over the side of the head, gallbladder 8, fabulous local points. Nice. There's a really good For the general migraine that you were describing with the throbbing fixed as a swath over the side of the head, particularly with visual disturbance, Pian Tao Tong Pian is a pill. It's the Chinese migraine pill. It's specific for migraines of the liver fire excess type. Once again, Pian Tao, T-O-U, Tong, T-O-N-G, Pian. But once again, it's good to get a good herbalist, because if somebody's of the wrong, if they're of a deficiency, like a liver blood deficiency, it can make it worse. Or if it's a wind cold excess external, it can make it worse. So, but if it is truly liver yang rising or liver fire, that's a specific formula in Chinese medicine for that specific type of migraine. Tianma Gotang Yin is another really cool thing to talk about here. It's a formula for the liver yang rising with the kidney yin deficiency etiology of migraines. This is the comorbidity of the night sweats, tinnitus, thin red tongue, low back pain, the underlying yin deficiency for the liver yang flare-up. It's so interesting because I told you about this formula for tinnitus. I told you about it for dizziness. And now it's coming up again in vertigo. So this is showing the world something about Chinese medicine. When you treat the root of the disease, a liver yang flare-up from kidney yin deficiency can cause different conditions in different people. One person's going to get tinnitus, one will get dizziness, vertigo, and one will get migraines, but it's the same cause. And therefore, the same formula can be used to treat those three entirely different symptom pictures. That's a unique difference between our two systems of medicine. It's very rare that a tinnitus medication might be used for migraines. Although you did say there's a lot of anti-epileptic medications that double for migraines, and they don't know why.
They don't, yeah.
So you guys have something similar too. But the Tianma Gotang Yin, I'm surprised to see that again, because I use that all the time for dizziness on people, for the right types of dizziness, for the liver yang rising, kidney yin deficiency, with liver qi stagnation. The Tianma Gotang Yin works fabulous. So I'm like, what's it doing for migraines? I'm like, okay, of course, it's the same root. With the phlegm turbidity people, this is the too damp with the thick, greasy tongue, heaviness. Decrease the damp, drain the damp. So you could do that with digestion, spiking up that, not spiking, tonifying the spleen, stomach, using those stomach 36, bladder 20, the spleen 9, those type of acupoints, and then using Gui P1 and other formulas that are good for tonifying the spleen and reducing dampness. The Xuanshang Cha-Cha Tian Wang will work well for that condition as well. As I mentioned, that's the wind damp, external. The internal damp will also respond well to the Xuanshang Cha-Cha Tian Wang. And then the blood stagnation. So this is a great one for Chinese medicine. Similar to tinnitus could be created from blood stagnation in the ear. People that are in war that have to hear a lot of gunfire and bombs, they're going to have blood stagnation in their ear causing tinnitus. So we've got specific formulas to move the blood in the ear to resolve tinnitus. In this case, we've got specific formulas to move the blood in the head for blood stagnation type migraines. These are fixed, stabbing, throbbing, chronic. Tong Xiao Ho Shui Tong, beautiful formula. Chi Xiao, Xuanshang, Tao Ren, Honghua, 4 big blood movers right off the top. Song Bai, Da Cao, Shangshang, Shi Shang. These are all dispersives. They disperse the blood. So it just moves the blood, disperse the blood. It'll be an expensive formula, but it works. And then there's a couple other formulas that are lower grade hitters. That first one, the Tong Xiao Ho Shui Tong's got a lot of hot herbs. So the person's got, there can be multiple differentiations. So they got blood stagnation with liver fire, and they give that formula, it's going to make it a lot worse. So this is where good herbalist has got to come in. If it's blood stagnation where a little heat could work, you can take, then that's the formula. If they're already hot, you got to go to Shui Fu Ju Tong. There's a beautiful blood moving formula, or just the simple world famous Shi Xiao San. It's a menstrual formula to relieve menstrual cramps. It just got 2 herbs. It just moves the blood. It's very soft, very safe. Wuling Zhi and Pu Huang. I'll let you look up Wuling Zhi, but Pu Huang is a bee pollen. It's a beautiful formula. So, I mean, with blood stagnation, circulation, move the blood. Cardiovascular helps move the blood. And that for those type of people, possibly just a Motrin might work too. For the internal deficiency cases, you got to tonify them. They got blood deficiency and build their blood. Chinese dietary. Build blood, feed them blood. Blood soup, blood sausage. The Chinese are kind of crude in that way, in my personal opinion, although I love them as a culture. And they've housed my family for generations. So I don't want, but yeah, they like blood. So they actually evolved through selective breeding black bone chicken. Chickens with black bones. They say they have particularly rich marrow and a lot more hemoglobin available through stock. So black bone chicken soup. Si Wutong's the herbal formula, 4 herbs to tonify the blood. It would be great if the clients were this simple. Oh, it's a blood deficient migraine. Take Si Wutong, classic 4 herb formula. Gosh, if it was that simple, it'd be great. Sometimes it is. You see enough people, sometimes it is. Generally, it's a little more complicated. Kidney deficiency, gosh, that's tough to treat. I mean,
we've covered that.
Better not to burn the kidneys out in the first place than to try to tonify them. Acupuncture works well for the kidney deficient people. Kidney 3, CV4, spleen 3, bladder 23. Qi deficiency is going to be very similar to kidney deficiency. They're both going to have a lot of lassitude and fatigue, worse with exertion. But the kidney deficiency is going to have the comorbidity of back pain and knee pain. And Qigong. Somebody's got Qi deficiency, Qigong. Build the Qi. Do some Qigong. And Nuka Bajantong is a great formula. The 8 treasure decoction to benefit women after childbirth. So it's a formula designed specific to boost women after they've had childbirth, which can be a particularly depleting phenomena. So it's a very strong formula to tonify the qi in blood. It's a little bit unusual to see it in the treatment of migraines, but it's definitely applicable. So that's most of it from an academic perspective. What I've given you thus far is academic stuff, things will be taught in school. From a clinician's perspective, somebody that's done thousands of sessions, which we both, we've seen a lot of people at this point. I say we're in the middle of our career. We're not 35, 40-year practitioners. We're 15-year practitioners. But it's enough to have been around the block a couple times. It seems about 80% of the migraines have muscle tension involvement as well. So massage works fabulous.
Yeah.
Really does. And movement therapy, so people can loosen that themselves. And there seems to be about a 20% vascular component. So dealing with the emotions that pressurize the blood and bring it up to the brain, giving people meditation and coping mechanisms. So they don't drive it up, and stop and educating people from a very practical perspective to see how they're responding within their body to their environments and giving them empowerment tools to not pressurize their body in those ways to satisfy their needs a little softer or subtler. And then also, not all vascular is because they're driving some of it, they're just blood deficient, getting them to eat the right food and take the right supplements. I mentioned the blood tonifying through blood. You can also tonify the blood through vegetables, spinach, beets, collards, kales, beet juice, that type of stuff. Iron supplements. All right, so that's an overview of the treatment.
Nice. So it seems to me you've got to get the diagnosis in the first place. It's obviously going to help to get the correct diagnosis from a Chinese perspective.
Now, that's authentic and honest when it comes to the use of the herbal formulas. And the 8 principles is required. And my Chinese masters, like Dr. Hong Jin in Portland, Oregon, who's a lineage master herbalist. Her parents, grandparents, great-grandparents, her father oversees a whole state's medical system. Her mother is in charge of a whole ward in gynecology. I mean, she's like, look, you got to do 8 principles to do Chinese medicine. All that other stuff you're doing, the shiatsu and all that, those are accessories. If you really want to do Chinese medicine, you got to do 8 principles. Okay, great. That's true. That's especially for the use of herbs. Now, if somebody's got migraine on the side of the head, massage them and do acupuncture on the side of their body. Pick a lot of acupoints in the triple worm or in the gallbladder meridian. Yep. If somebody's got migraines more along the midline, do a lot of bladder points. try to find out what organ it is and do the back shoes for those organs along the bladder. Do local needle point where the person says it hurts, find the meridians involved, and do a few distal points. If you do migraines in that way, you'll relieve a lot of people, and you don't need to do so rigid of a TCM differentiation.
Nice.
Now, if you want to go in herbal intervention, I highly recommend you do, because there are contraindications.
Cool. Yeah, but from medical acupuncture point of view, that's great. You know, local.
It's not as do the meridians.
Do the meridian.
If it's on the front, do stomach. If it's on the side, do gallbladder. If it's on the back, do bladder. Go down the channel and look for the big sticky spots. Stick needles in them. Just boiling it down each time a little. Right on.
That's pretty cool. What an interesting topic. I really enjoyed that.
Migraines suck. It's really hard for those that have them.
Yeah.
Avoid heat and dehydration. Prevention's better than any cure, especially with migraines, because when they're in, they're sometimes hard to shake.
Yeah. Absolutely.
Yeah.
Absolutely. Yeah. Hopefully, if anyone's listening that's got migraines, this serves them, helps you out on some level. All right. I think we're cooked, eh? I think we're done.
Yeah, nice talking to you.
Yeah,
appreciate your friendship. Good friends, good medicine.
Till next time, no idea what the next topic's going to be, but if you like this, let other people know, share it on Facebook or LinkedIn or wherever you're up to, and we'll be hopefully back in 2 weeks' time with another topic for this podcast. Till then, see you next time, brother. Take it easy.
Aloha.
Aloha.
Good health.